We are very interested in T-cell fitness, actually independent if we are looking at AML, ALL or lymphoma setting, but focused on the hematological disease entities. And we were always wondering if this continuous exposure to a CD3 engaging bispecific might, very similar to chronic viral infection, induce T-cell exhaustion. And we first tried to validate our hypothesis by looking at patients who received blinatumomab. So these were ALL patients who received blin as approved over 28 days. And we could actually see that T-cell function, so if you do the functional assays and take peripheral blood from these patients every week, there was actually a decrease of T-cell function, so looking at cytokines, T-cell proliferation and cytotoxicity. And we developed an in vitro model system mimicking this. And to cut this short, we could sort of replicate our clinical findings. And interestingly, there were two ways to counteract this T-cell exhaustion that was induced through the chronic exposure. So either we just integrated treatment-free intervals, so 1 week bispecific, 1 week off, or we could also add Dasatinib, which has been shown also in the CAR T-cell context to prevent CAR T-cell exhaustion. So I think although our data is clearly not valid on, what is the time interval to prevent T-cell exhaustion, I think it highlights that chronic exposure to a bispecific, probably similar also to the CAR T-cell field, chronic exposure to a target antigen leads to CAR T-cell exhaustion. T-cell fitness is declining, and we need to think of mitigating strategies either by small molecules or, in the case of bispecifics, of doing treatment-free intervals to prevent T-cell exhaustion and increase T-cell fitness.